My name's Allan Kalus, and I'm very proud to be a member of the Australasian Society of Aesthetic Plastic Surgeons. I've been a member for about 35 years, and this is actually our 42nd clinical meeting. Once a year we get together and we discuss all pertinent issues in aesthetic plastic surgery. We are fortunate this year. We've had a number of people from overseas, especially Dr Allan from Lyon in France, who's come to share with us his technique of fat transfer to the breast. In Australia we call the operation autologous fat transfer, and I'm very privileged that in my practice, Avenue Plastic Surgery in Melbourne, we've been doing the procedure for about the last 5 years, and we've pioneered it in Australia. What autologous fat transfer to the breast offers is an entirely natural, organic way to do breast augmentation. So we're able to avoid implants entirely for many people. The limitation is that the volume that we can obtain depends on how much fat we can obtain from the patient. So sometimes it means we can only get a 1 or 2 cup size increase. But of course that's perfect for a lot of women who've had children and perhaps lost a little bit of volume from the upper part of their breast. For those people that want a larger increase in breast size, we can also use fat as a hybrid procedure. In other words, we put an implant in, and in that way the woman can choose virtually whatever size she wants, but we can use the fat around the implant in a strategic way to, for example, improve the cleavage. Because one of the points that was made at the meeting was that cleavage is actually more important than size. And so an implant does not really address the cleavage very well. So especially in women who are a little bit bony in the cleavage, for thin women, low BMI, the cleavage is so important, and moving a bit of fat from their inner thighs or hips into the cleavage greatly enhances the result of any breast augmentation procedure. There was some talk about harvesting of the fat, and of course women who have fat transfer, they kill 2 birds with 1 stone, as it were, because we can take fat from the hips and thighs, and after all, who wouldn't like to lose some fat from hips and thighs, and after preparation we can graft into their breasts. So for me, in my practice, we do a lot of standalone procedures where we're just taking fat from hips, thighs, tummy, wherever, and grafting into the breasts. Especially the cleavage, we're very strategic where we put the fat. And of course we're doing many procedures where women who want the larger volumes, we can add the fat to an implant. Another operation that's becoming increasingly common is removal of implants, because with 20,000 breast augmentation procedures a year currently being performed in Australia, many women after about 10 years find that they're tired of their implants, or they're having complications from their breast implants, and we know implants are not lifetime devices. So many women now want their implants removed and replaced. And now there's the option: we can replace it with their own fat, or we can replace it with another implant with a little bit of fat to the cleavage, and in that way get a much better result. And the other group of patients, of course, are those women, and we know sadly 1 in 10 women in their life will develop a breast cancer. And what a wonderful way now to help these people, that when we do a mastectomy, we're able to replace the lost breast tissue with their own fat. And my aim in these situations is to try and leave the woman with an even more attractive breast after the mastectomy than she had before. So often this means we can correct a sagging or ptotic breast, and it means we can maybe reduce a very large breast to a more manageable size, or if the woman had a small breast before excision, we can even increase the breast. So it means looking at both sides, producing symmetry, addressing the cleavage, and these are all things which plastic surgeons in Australia and New Zealand have been discussing here at the meeting.